Welcome to the Reverse Mullet Healthcare Podcast from BP2 Health. Today we're in the studio talking with Becky Fox, seasoned health informatics leader, and Eric Utzinger, co-founder of Revuud. But first, who are we? Why are we here? And most importantly, why did we name this the Reverse Mullet Healthcare Podcast?
And why does Dave have a hard time saying Becky?
Becky.
5 takes.
Becky.
Well, it's because we want to be relevant, informative, and creative, but we also want to be entertaining and have fun. So it's like a party in the front and business in the back.
Just like
a
my
mullet,
wig.
only reversed.
Just like my wig.
Like Ellen's wig.
We are your hosts, Ellen Brown.
Justin Politi.
And Dave Pavlik. We are passionate, innovative, and collaborative, and are committed to solving some of our industry's most important issues together with our clients. We have a combined 90 years of experience.
Super old.
And with now that there's 5 of us in the room,
there's got to be 100.
Probably adds up to like 160.
160.
Okay.
Wow. This is a definitely an episode for the ages.
No doubt.
Carson.
And we're not going to be at all gentle on Ellen on this one.
We're going to
everything's lined up here.
Yeah, the odds are stacked totally against me.
We do dig into hot healthcare topics. And dig into each other sometimes. And today, emphasis on hot.
And today we're digging into something else hot.
We are. So before we start, this episode has a warning label attached. And at first for BP2, we mix in spice with healthcare talk while we interview our guests. What could go wrong here?
So many things.
On the table in front of us are an array of hot sauces lined up from mild to hottest. And we'll be taking some tastes along the way. Like another unnamed show, we know, but this one will be self-governed.
Why does it have to be unnamed? I haven't been meaning to ask.
It's probably some sort of like, we won't be able to publish it or something. It's better to stay away from it. People know what we're doing.
Nobody knows what we're talking about here. It was just a vague reference to some other show that has nothing to do with hot sauce. So those who want to stay in the shallow end of the spice pool, I'm not going to cast aspersions, shallow end of the spice pool. And then those that want to take the bubble off their backs and dive into the deep end. Remember the bubble that you used to wear and swimmies? They can do that too. That's on this end of the table. Don't try this at home, kids.
Well, this should be very interesting. I'm just going to say right now, I'm going to throw down a little that I am going to try to make it really far in this challenge. This, I really am. I thought about it this morning on the drive over. I had a number of hours in the car by myself in the dark. And I thought, I think I'm going to try not to wuss out on this. I think I'm going to try to go in. Yeah, it'll be comical nonetheless to watch me do it.
Are those tofu wings over there?
They are a plant-based alternative to chicken.
I knew it. You lied earlier.
But I am going to use the sauces.
That's all that matters.
Exactly. And there is no seasoning in these, and there is no hidden element to make that. To counteract this. They're just like chicken.
So we'll have to go on her word on this.
Yes. And I'm going to say, Justin, honestly, I think Justin's been preparing his entire life for this.
Not that far off.
And I honestly feel honored to be in the room today and to be taking part in this whole competition and to talk about healthcare at the same time. I think this is going to be the start of something.
Is it
or
right?
it'll never happen again.
Is it right and fair that Eric gets credit for coming up with this idea?
He does. He won't give himself credit, but he should get full credit.
Well, I noticed that Justin didn't give him.
I'll tell you when it's over, whether I'll take credit for it or not.
All right.
Well, everyone's getting a little nervous right here. I can hear it.
The idea is yours, so you can't. You have to own it now, bro.
So let me introduce our guests. I'm going to start with our first guest, Becky Fox. So we have a 2-for-1, right? We have Becky and we have Eric. So like the three of us, you started your career last century, but
we're not dating. Well, we're saying we're all old here. So
I'm doing the math in my head, and I don't think that's right. Last century, but keep going.
The 19th. I started in the 90s. Did you not start in healthcare in the 90s?
Oh, yeah.
My wig was actually maybe...
Thank God. And there's been no beer that's been consumed as of yet.
No, we haven't even... we weren't even allowed to crack these before,
I'm an imbecile. I'm going to have to edit out that.
No, that's actually really good content.
You know what I had going on in my head? A century has to be more than 100 years ago. That's not right.
No, you can't cut that out. That was too good. So, but I will start back up again. But in health IT, where she designed and implemented EMRs and led physician training, you then joined Cerner, and you worked as a healthcare executive around the world to help health systems on their EMR journey. Yet again, an underachiever in our midst. After that, you joined Atrium Health as the CNIO, which I'll let you explain what that is. But it is a new decade position. I will say that decade did not exist.
What, CNIO?
I'm sorry, in the last century. I can tell you that did not exist.
Okay, I haven't heard
the
it.
19th century.
When the time is right, we'll have to try to guess.
All right. You want to guess? What do you
Not
think
right
it
now. I have
stands
to
for?
think about it a little bit.
Okay, all right. Well, anyways, so she was with Atrium as the CNIO to help lead a large-scale EMR optimization project, and from there went on to do enterprise-wide EMR conversions. I think you should have been on our LinkedIn Live the last two sessions when we talked about Epic. Like that would have been, and EMRs in general.
Oh, Chief New Innovation Officer.
Nope. Nurse.
Oh, no. Well,
Are you a nurse? I should have asked you. Okay. I should have asked.
Try again.
I was
what do
going
you
to ask.
think it is?
So CNO's Chief Nurse Officer.
There's an I.
But there's an I in there. So Chief Nurse.
What started in this century?
Oh, okay. Chief Nursing Information Officer or Informatics Officer.
Okay. All right. Well, there you go.
Didn't know you were
you
a
then
nurse.
led one of the first, this is super cool too, is you did lead one of the first mass vaccination events in the U.S. during the pandemic. We talked about this at lunch, which
Very
is super
cool.
where you learned the value of partnership with incredible people from Bank of America, Honeywell, the Carolina Panthers, and of course, Atrium Health. During the pandemic, you also founded a company called Vital Circle, where you helped bring people together in a safer way. And you offered verifiable contact tracing technology, vaccine verification, online, on-site testing, and a host of options to develop a customized experience when people held conferences, events, or meetings. And just to prove that you were Wonder Woman, you went from a hackathon to a prototype to your second client being the Republican National Convention. You went on to provide services for Fortune 500 companies like Home Depot, Honeywell, and Rotary International, and found your love for the entrepreneurial atmosphere. So when the opportunity came to co-lead a 250-plus person informatics team, and that would have given it away at Intermountain Health.
For sure.
But I made you answer it before. You had to naturally jump at the opportunity. So, like I said, yet another underachiever in healthcare. I'll hand it to you, Dave, for our 2-for-1 guest.
Thank you.
Our second guest.
Eric Utzinger.
Yes.
Welcome to the podcast. Thanks a lot for being here. We appreciate it. Eric started working in healthcare in 2002, mostly on the sales and client development side, working with products and devices. In 2008, he took a job with Cerner at Becky's Nudging, where he worked with the client development team in sales and community hospital space. This allowed him to see how small organizations have the same challenges as larger organizations and the need to find creative solutions. He then joined the world of implementation consulting with Max IT, which became Leidos. In 2015, he joined Cumberland Consulting Group and saw the expansion of offering advisory and implementation services in the industry and kept hearing the need for speed. That's written in all caps right here. And cost containment.
So you made sure you said it that way. Need for speed.
I did a good job, and that comes from
the need for speed.
The need for speed. And I can't remember what movie. Oh, Talladega Nights?
Yes.
Yes. Excellent. And cost containment and implementation from all sides. Justin, why did you?
I just wanted to mess with you.
Why do you?
Eric's like, no, that is
I can
wrong.
never get my movies right. Was it okay?
I've already given him enough flack
it-
over
Right in the middle of
Motley
the
Crue
important
today.
part.
Why are you-
all about me?
All- why?
Said it to Goose.
Why do you
Wasn't
do it?
shaking
Was it
face.
who said it? Maverick or Goose?
No, they both said it together.
Said it together.
Okay.
Slapped hands.
Wait, so then the two of you could be Maverick and Goose, so say it together. You have to go in the
I feel
microphone.
the-
Wait.
Say it.
I feel the need for
that speed.
All right,
All right.
Okay,
man.
this is going to be fun.
In 2019, he decided to do something about this and co-founded a company called Revuud, where they created a technology platform to easily find and engage IT talent in a quicker way. Impressive background for both of you, honestly. Regardless of Ellen's comments about being underachievers. We were super,
I know.
I'm
Well, 'cause,
super-
I'm very literal.
super-
Actually, I usually
super
am. So.
impressed. If you guys have listened to any of our podcast episodes, we typically start with party in the front which
Well, this is whole
has
the whole
been-
episode. I feel like there's like a party
There is a
just
party in
the
the
whole
front.
time.
Yeah, so we like to start conversations with fun things like questions to guests, such as I don't know, just a random.
Can you play the ukulele?
Can you
like
play
what's
the
something
ukulele?
random
But how,
about yourself?
have you ever put 9 spoons on your head? How about that? Is that a
I have, yes.
what?
Yes.
Seriously? Okay.
But wait,
Okay, all right.
These are big spoons.
I feel
I
like
figured
so.
he might
I will tell
Google
you
it.
this.
It's
I will
okay
tell
if you
this.
can't do all 9.
They're heavy too.
I know. I was
concerned.
concerned about this, but can you do
For
any
our
of
listeners,
them?
Ellen
let me
just
give you a
handed
little
9
background.
spoons to
When you're at a
Eric.
wedding for 4 hours with people you don't know, what do you do when you're sitting around the
Hat
table
tricks.
for a while? You start tricks, right? So
And there's no
it
hats.
started with a
Beer.
nose. Most people do. So
So Eric is now going to
it's a
start.
very heavy spoon, and there's no way that's sticking. This one's a little lighter.
There's a
I
small
know,
one.
There's
see.
a little one.
I brought
Yeah,
you a
that
little
might-
one.
That might be too little.
This will make my daughter happy because she doesn't understand why we have so many
It's
different
too heavy, though.
spoons.
But you can. So it depends. You can get
There's
really
a trick
creative.
you're doing with blowing on the
So
spoons.
far, he's failing.
You got to get a little sticky.
On your
So you kind of
ear.
hang them from your ears, and then you go the nose if you can get it, and then you go up top here, chin, and then you squint 2 in your eyes, and then if you're really good, you can get them here too. And I'm not saying it's easy. I wouldn't try this at home,
But you've done
You got
it.
but I
9.
have done it. I've got it very briefly. But it became
Still
kind of a
counts.
thing that there's Eric doing his spoon trick again during wedding season when all your friends are getting married and stuff. So yeah, and here I am. I still talk about it today.
You're a
Very
good.
proud.
You're a good sport. Thank you for.
And it's just heavy spoons. Oh, this wouldn't surprise her at all.
No, I know. Well, and what if when my daughter watches this, she'll be like, "Yep," and there is our spoon drawer. She texted me this summer and said, "Why do we have 6 different types of spoons in our spoon drawer? Like, why are they all different?" I'm like, "Because I'm in my 50s and I have collected a menagerie of spoons. Like, no longer do I have a set." I'm like,
And then the follow-up question is: have those been washed?
"Yes, they have been washed."
no.
No, I mean after you get home.
Oh, yes, exactly. So
All right, enough.
the time has come.
Yes.
Oh, boy.
Oh boy.
So now it gets real.
Well, explain for the people that aren't seeing this what's happening right now, like why you're
I'm not
saying
even sure
that.
what's happening right now. I've lost no. So what we're gonna do? We're looking at a lineup of
Hot sauces.
8 hot sauces with a glass skull at the end, and I know it's in that one. It's a very lethal habanero. It's
There's
got
no
a
chance I'm touching that one.
from the front end, which is a Cholula sauce. That's like your mild sauce that you're going to see in every supermarket. You see some other hot sauces along the way that are gradually moving up the Scoville scale. And ultimately, like I said, you're at this tail end here with the hottest sauce here. Now, we also have some ranch if you want to do some
That was
cooling
my
down.
I
contribution.
mean,
Wait a second.
all right.
You could add this to
You probably
these
don't
to
wanna
make
read
it
the
cooler.
label.
No, you just put it on.
I was gonna say,
dip it.
Can we blur this out?
Oh, after like your
you
mouth
eat.
is on fire.
So
Like emergency
if you,
milk or
if you,
anything?
so this would help if emergency.
we
like if
only
you're
have
really hot.
3 wings on our plate. Does that mean we're going to try 3 sauces?
We're going to try 3 sauces. It's
I
going to be
am
intermittent
just
throughout.
smart that way.
Yes.
I have a feeling Justin's starting at the desk.
Wait.
Now I'm gonna
Wait,
start
what
with
if we
Alan's.
want to try to make it?
Well, you got like 9.
Well, I have more of these nuggets if people want to try. I guess.
We're going to do
Well,
3
wait.
spots to start. And
All
if we
right.
want to go beyond that, there's no rules, but I put in 3 spots because I figured
Okay.
Take a bite
gonna-
and rotate your wing around. I mean,
Oh,
Another
that's true
option,
too.
too.
True too. Half
Yeah.
of the
I'm
ring.
going hot.
so.
do you
With that
start
being
with?
said, we're all going to pick which one. I'll go last. I'll let you all decide where you want to start. On your first
I'll do the play-by-play so we don't have a bunch of dead air. Becky
oh, you.
Becky went for the first one.
Going
Cholula.
first.
Cholula.
Yep.
I'm gonna go middle.
Oh, middle. No chance. What is it? Let me see.
It
Read it,
is
read it.
Waltz habanero pepper sauce. Waltz
So
Fish
while they're doing
Market.
that, tell us about the scale.
Sarasota.
What's the scale called?
Scoville scale.
Scoville scale.
I don't have the numbers on each
And
of
that's
these.
a
but-
legit scale of hot sauces?
Yep.
I'm gonna go this Rojo, just because I'm not going
No, we're just
directly
doing
to that
one right now.
We're just doing one right now.
See that?
I'm gonna
Ooh, I
I'm
smell
gonna
it.
open my beer first because I'm gonna need
boy.
to wash
Eyes
it
are gonna
down.
start watering in this room here.
Here's your beer.
That smells really hot.
Now we're allowed to open our beer. Mine smells hot. It's like hurting me from here.
Oh boy.
A beer because you cannot eat wings and not wash them down with beer. Look at what
We will
Justin
be
just
drinking
did.
responsibly. May I have the beer opener?
Justin,
Bottle opener, sorry. Oh, thank you. Just trade you? I love it. This gentleman opening my beer for me.
Yes.
I got one more.
This is been
It's a
told
Friday
this is-
afternoon.
Been told this is a first for this studio too. Wings and beers in the Victoria. Would you like to come and partake in a hot wing? Feel free. We don't have a plate for you, but no. Our producer, she's passing on the opportunity. I'm gonna. Oh, sorry. I'm sorry.
All right, Justin, how are we doing this? How do you want us to do this?
On the count
I
of
went
three.
with that one.
Hold on. I'm going
I
to.
went with that one.
Can I
Here,
have
I
it
got
first?
some right here.
I just want to see if Becky's
Same one.
Yeah.
That's okay.
And then Becky, when you talk, Justin, make sure if Becky's talking, just hand her over the mic. Okay. Thanks.
I'm going with the same one as Eric, the Rojo.
So wait, so Justin,
went
you went
hottest.
hot. I went hottest.
You went hottest.
No, I went.
Well,
the one
You
that
went this one?
You went skull.
No, I went with the.
Did you go skull?
You went with the.
You went with the Steve-O's.
The Steve-O's.
Ellen, did you go skull?
No.
Oh, you said
She went
hottest.
one back.
Well, hotter than us.
Okay. All right.
She's
I'm
one
already
more.
sweating.
I'm starting.
I'm already.
Yeah.
All right.
All right,
so
let's
I
go.
dip
So
it.
1, 2, 3.
Ooh.
I need a napkin. Have a napkin, please. It's a child's play.
Yeah.
Of course, I hardly put any on it. I mean, Justin drenched his in it.
I don't. Yeah, he had more sauce than wing.
Yeah, I'm not really that. No, it didn't really bother me
All
that
right, I
much.
think the next time we do this, we have to put a lot more on.
How was yours?
Okay, we will.
You know, I'm gonna actually go for a second because I survived it.
Oh,
You did?
I did.
Okay.
All right, I'm ready for another one.
I think you gotta.
Is that hotter?
yeah.
Okay, I think we're getting ahead of ourselves, but
I know. But I feel like the first
Stick
one.
with the same wing because
Yeah.
I am.
I don't mind this.
That one's got some kick to it.
It has kick and it kind of gets in there and burns, but it's manageable.
Yeah,
It's manageable, very manageable.
interesting.
You can tell that I'm left with boys in my house because I'm like, all right, I'll go for the hot one. Okay. That's all right. You know, I
right, so that was-
tried, I'm going to go on record.
right.
I tried, we were at Epcot last weekend and they have the Food and Wine Festival and they have they have like a whole wings section. And Bolton's favorite place, my
it's a little
son
hot.
Bolton's
Yeah,
favorite
not
thing
terrible.
is it's like called the impossibly
Hit me
hot
a little bit.
pepper, like ghost pepper kind of crazy hot wing. And he had them last weekend again. And I almost if I hadn't been shamed by my family, you would have them sitting here. Because I wanted to bring them back and bring them to this wing episode. And they're like, that's not going to work. It's, so cheers.
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 Cheers to wings
All right,
and
so
friends.
that was a first for
All
our.
right.
This
I
one,
mullet
this one's
definitely going skull, man.
This one's got
You're
some.
gonna go skull. Okay.
You got to get a bunch on it.
My lips are
You gotta
now.
get a
My
bunch
lips are
on
starting to
Me
burn.
too.
now.
I did, and I
It's an
used it all.
aftertaste.
Yeah.
Yes.
Yep.
It's
This
sneaking
one-
up.
But it's
It sneaks up a
manageable.
little bit.
It's sneaking
It does.
up.
Not gonna
Okay.
Oh
kill
boy,
you.
it's creeping.
It does.
All right, it is
does,
creeping up.
yeah.
Which one? The one I did that I.
This one, yeah.
Yeah, I did it.
It's gonna creep up on you. Wait.
No, I did 2 dips and I fully ate the area.
All right, my tongue's on fire.
So now we will move to someone with the love of synchronized water ski shows and performances with costumes, music, and fanfare. Sounds like someone wants to move to Orlando, if you ask me. Maybe.
Maybe.
Becky, I need to hear more.
This is just the best ever.
Yeah, we were laughing because I was teasing Ellen that I really work in health IT just so that I can support my water skiing habit. But yeah, I fell in love with water skiing many, many years ago. And so get to perform with the water ski team and being able to coach over the years and just meet people from around the world. There's always like 7 degrees of separation from somebody who's connected to someplace in Florida or Wisconsin or water skiing. So it's been a fun adventure to be a part of that.
Yeah, but I have to be clear. It's not just the water skiing, okay? It's like being a swimmer or being a decorative synchronized swimmer.
She spins around.
I know.
and-
Like
yeah.
you
Yes.
can like perform on skis. You're like the not the wiki wachi, that's the mermaids. You're the Cypress Gardens, like climbing on top of people, like doing gymnastics
Really?
on water skis and
Oh, yeah,
costumes.
there's towers. There's
I'm
towers.
a part of a group that does amazing water skiing, so I get to
Yes.
hang out with
When I
them.
was
So
a
they're-
kid,
they're
I don't know, I've been into boating for most of my life.
Yeah.
And when I was a kid, I'd go water skiing. I thought it was so fun, and I was, 2 skis. I
century
wasn't
ago.
good. I wasn't good, but I liked it so much that I subscribed to the Water Ski magazine
Yes.
and would see pictures of. I think I might have saw you.
You might have.
where
You've
you
been to lots
recognize
of
her
different
from.
stations.
That's where I
Yes, of
recognize
course,
her
of
from.
course.
All
All
right,
those
okay.
great photos.
Yeah.
They were all me. That's
And
right.
they do it
So-
on New Year's Day
Yes.
often in North Carolina, which is not the warmest water in the world. So
Probably
No.
not.
So it's the longest running barefooting tournament that we host. And I do not barefoot, but I have kids that barefoot and lots of friends that do it. So I make the chili that day. It's not very spicy, but it's great chili. If you're
got some
in Lake
sauce for you for
Norman,
Did you say
Yeah.
barefoot skiing? Too?
Barefoot
Oh,
water
my gosh,
skiing,
all
yeah,
of it, all
so-
of it.
yeah,
All right, well,
so
let's
it's
keep
a
it
lot
going.
of fun.
Since you have the mic, what other things do you like to do outside
so
of work?
water skiing, chasing my teenagers around to try to hold on to them.
3
to stay
teenage
young.
boys.
3 teenage boys.
Twins.
Yes,
In
twins.
that mix.
Twins that are 17, and then a 15-year-old getting ready to start his driver's ed. So
Everything needs to be wiped down in the house.
everything needs to be wiped down the house.
Justin and I have 2 boys. We know.
Yes. There's a special door into heaven for mothers of boys. I've come to that conclusion, but yeah, they're a lot of fun, and they're all into different sports, and real thankful they love water skiing too. So we get to do it all as a family and spend a lot of time outside. So it's great.
What do you like to do? What about Eric? What do you like to do outside the office?
I enjoy being
He's
on the
known
water
as
as well.
yes, but he's really known as the crock pot. You have to ask him about that.
Kind of a lot of different nicknames. Crockpot's one of them. Playing in an adult basketball league that we've been doing for 20 plus years, not quite a century. Feels like it some days, but we play in some pretty cool places.
Yeah.
And it's a bunch of grown men with, we keep all our stats. We have drafts, we have refs, we have shot clocks, and some take it more
real deal.
seriously than others. And so it's pretty exciting and gives us something to look forward to every Thursday.
All right, now it's time for round 2 on the wings.
We already actually had round 2, so we're gonna.
We're gonna. All right, well, this is the official
round two. Okay.
Well, we gotta step
gotta
it up
go
to
We
this.
higher.
got to
now.
step it up. I'm gonna try to hang with Eric.
But are we only doing 3?
We had 3 wings, but we've been rolling them. Eat half of it and then do the
You
other
got
half.
plenty over there.
Okay.
Don't worry, we'll take some of your.
I do have plenty of
We'll take
plant
some of your
protein.
plant-based protein. I'm gonna see if I can hang with Eric.
Like, is that enough?
And if Eric,
Do I need to put more
that's
on?
plenty.
That's good.
Okay.
Soak
I mean,
it, though.
I
You
want to
gotta
be
soak it
like,
in there.
right. I need to I can't just make it like a drop where it's not.
My lips are
legit.
still not cooled off from the last one, so I might not get very far.
Gonna try the garlic, the ranch.
Well, that'll
No,
cool it off.
down.
If you,
Yeah, I don't want to get that
so you got to
wimpy.
get them dressed. You have to get it dressed like this.
Right. So we've
See?
got the.
Oh my god!
So we've got
This is how
the-
you dress it.
Oh no!
Let me
No!
see.
No! 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 No!
All right. I'm
Look at
dressed.
this, look at this.
I'm gonna follow
Wow!
Justin's
All right,
lead.
I guess I'll.
And I think
her go
I've dressed
first.
it a lot better. Like
right.
that's okay.
Yep.
Like
Yeah. All
double.
right. I used. All right. The whole thing's covered.
Ready?
I'm ready.
1,
Okay.
2, 3.
This is gonna be good audio. I have to pipe in some music.
All right.
A little hot.
Hotter.
Yep. I'm surviving though. See, you brought all these lightweight sauces.
I did because I had no idea what the.
tolerance was going to be, but I'm going for it. I feel proud of myself.
Lightweight sauces. Give her the
They're
skull.
all pretty mild.
This one before the skull or
Well,
after the skull?
That's before the
right.
skull. I mean,
Yeah.
I'm only got 2 left, so I'm doing pretty. I'm proud of myself right now.
I'm thinking there. Okay, with me, it's like it comes to haunt me a few minutes later.
I think the Steve-O's is very comparable to habanero.
Yeah.
Although the Steve-O's has a heat that makes me hot from inside. Like I feel there's a perspiration
I know.
from my chin that came from the sauce. Like that was not there for the habanero one.
All right. So, do we want to move on to? Oh, we already talked about the men's basketball league, right? The detail.
Didn't quite explain the crock pot theory.
All right, so let's hear this.
NASCAR.
They basically
NASCAR.
say it's got the nickname a long time ago. Pretty decent shooter, not very athletic. But I take a little while to warm up, so I start out a little cold, so I'm like a crock pot. But once I get hot, I get pretty hot.
Okay.
Oh,
I'm like
interesting.
I'm like Steve-O's here.
Steve-O's
eventually.
it's a creeper. I'm gonna say right now, Steve-O's hot sauce is a creeper.
It's catching up to me again.
It is. It's a creeper.
does.
This one does. This one is like it's like the creeping hangover. You know,
I,
where you're like you wake up okay, And then as the morning goes on.
Yeah.
I actually just would really like to try one of those plant-based things right there. If you don't
Okay.
mind, just drop one of them puppies on my plate.
Yeah.
Thank you.
They're actually quite nice. You can make fun of me all you want.
I'm drenching it in the same one we just had, the Steve-O.
All right. Oh, you just want to make sure that, like, I am legitimately.
It's like it's got some reverse.
It doesn't.
Reverse properties in it.
It doesn't, though. You're just making sure. See, that
So
was
you guys
his-
are all just warming yourselves up to.
I'm going skull,
Okay, I
man.
like
Not
that.
next, but I am going skull. I'm going to need a 4th round. I'm just going to go on record.
Yep.
Is that what it is, Steve-O, that we're having right now?
It-
That's pretty spicy.
It sits with you. It sits in there. Like, it fires up a little bit after you've eaten it. So are we
done with party in the front? I don't
No.
think so. It kind of seems unusual to be done with party in the front when we still have wings to eat, but I guess.
Well, we can divert here and do another round and then finish party in the front.
We'll just throw it in there. We'll just throw in the wings while we're talking.
Throw some plants around to everybody.
Yes. Let me hand these out.
I do have more wings. I just wasn't.
No, but this actually works. These work
try it.
quite well. Like
It
they're-
tastes like rubber. It tastes like nothing.
Yeah, exactly. It tastes like the sauce that you're dipping it in. So
Yeah, exactly. It works.
I thought it would.
Well, so we can move on to our discussion and get through the hot sauces as we do so.
All right.
So let's tackle a serious question. What are the biggest hurdles or challenges you face in your roles today? Becky, you want to go first?
Just getting through the wings with Eric is my first hurdle.
You got dragged into this.
Yes, I mean, he said you want to go out for
You get a
beer and
little dragged
wings, and
into
here
it.
we are.
Yes.
So,
You did not mean getting on a plane and coming down.
yeah,
to
I
the
didn't
podcast?
know. He's like, oh, by the way, did I mention it's in Tampa?
The
So,
implied
and can you
sale.
pick me up at
Yes.
5:30 in the morning? Yeah.
And you're driving me to the airport.
Right, you're gonna drop me off too, right? So,
Need a
yeah.
close-up of. Sorry.
Oh my gosh, you're really going for it, Justin.
Already? Are we?
He's just
already-
preparing.
letting it.
Oh my
I
gosh,
feel
he's
like he
letting it
might injure us,
marinate
though.
He's getting mentally prepared.
in the
Dumping the skull
preparation.
Justin is
Justin
preparing
is still going to get
his
the
next
like
wing.
he's going to win, but
Yeah.
Oh my gosh, this-
I am.
Woo!
I can smell it. It's already like I'm
are
sweating
you
from
reacting to
smelling
the
it.
I'm not
vegetable?
sure I'm a plant chicken guy.
Yeah.
Well, it's not meant to be. Like I want to be clear. It doesn't.
not meant to be chicken.
It doesn't. It's
Oh,
not
I gotcha.
supposed to be chicken.
It's just
where
a-
it actually works very well in lieu
just
of
a
chicken
plant-based food.
is like if you're cooking something that you're just going to put like steamed chicken into and like like a curry, something like that, or like a
see that.
chicken fried rice.
Yes.
This works well. But if you're trying to have the experience of a crispy chicken wing,
was a
you're not
little-
going to get that from here.
I kind of soaked that one a
Yeah,
little bit.
The Steve-O's?
I'm starting.
Yeah.
I'm
No,
starting.
the Steve-O's, I'm telling you, it's a creeper.
I don't think
you're gonna want.
I don't think I can go any higher than that.
I'm excited for the mango habanero.
I don't think I can go hotter. What about you, Eric? Challenges?
Yeah,
Challenges, hurdles.
Well, yeah, I mean, with what we're doing, I mean, just the hurdles of starting any company, no matter what you're doing. And so kudos to all of you here as entrepreneurs and Becky and some of the things that we've been doing lately. When you go change an industry as well, it's one thing to just kind of do things, but we're really challenging the status quo in a very relational business, which I get. I've been in a relationship business for a long time. So getting in front of clients when there's a lot of noise in healthcare, the people we're selling to are and offering what we think is a better solution. They're getting hit by 400 people every day with saying the same thing. We can help you reduce your length of stay, improve your outcomes, improve your revenue cycle, whatever it is, right? And so how do you get through that noise and how do you get in front of people in a meaningful way? And that's challenging. Once we do get in front of people, conversations tend to move pretty well. But it is. We're biding for time for with these leaders that a lot of people are fighting for as well.
How about you?
To me, the one of the biggest challenges in healthcare is just right now we need everything to go faster. All the other industries that you look at, manufacturing, travel, education, all of those industries are really taking technology, embracing it, jumping in and trying things out and moving really fast. And so that's what healthcare really needs to do. I often joke, we talked about my teens. I have teens that are 17, and the year they were born was the year the first smartphone came out, the first iPhone. And yet across the United States and around the world, there's still hospital organizations that, nursing staff don't have or clinical staff don't have a smartphone in their hand to help take care of
Which is
patients
insane.
and communicate. Well, not to say it's not for the weak. It's definitely not this end of the spectrum here for putting in those technologies, because there's other things you have to do. HIPAA, medical device management. I don't want to make it sound like it's easy. It's not to do, and it's a significant capital investment for those types of technology. But the reality is we need healthcare to go exponentially faster. We learned a lot during the pandemic. We need to keep going faster. And so we have to look at how do we put technology in faster, and then what other operational services like Revuud that can help bring the right people for the right time to help make things go faster.
All right. So do you want to do another wing before
go.
we jump into our...
Is anybody hot? It's hot.
Yeah, my mouth is. I mean, my tongue is
Another wing, and then
Mango habanero.
I do have some other wings that I can hop out quickly and heat up, and we can add more.
Or you can continue to eat the...
I'm going with mango
vegetarian.
habanero. Eric, step it
Yeah,
up one
me
more.
too.
Okay.
I'm going to go habanero.
There you go.
Extreme.
I'm gonna watch.
It's just called extreme.
We're gonna split a wing like that.
Oh my gosh, doesn't even.
You push them down.
He's just showing off.
Yes. Oh, he's getting.
Just watch his head. Watch his head as the sweat beads start
Well,
to...
Justin he's done the buffalo
It doesn't even.
hot wings
It doesn't even
challenge.
affect him.
Like what is it? The
Wild Wings Challenge.
Wild Wings challenge.
Blazing.
Did you
It's called
did you hear
Blazing.
that Andrew's going to do it this weekend?
No.
His son, they were at Buffalo Hot Wings,
You going there?
and his son saw that nobody had done it in 2024 at their place. And so Andrew's like, well, I am up for a challenge, and I'm a competitive guy, so he's going to do it this weekend. Apparently he's going to go down.
All right.
I should find out if it's going to be around here. You could come up and see it. Okay.
So this mango habanero
I'm going for the mango
on
habanero
the
too.
scale is hotter than all these ones. Mm-hmm. Doesn't seem like it because it's got some sweet. Oh, here.
Sweet.
Wait.
Oh, I have. Okay, so I'm going for it.
Oh yeah.
Whew. This one will take you down the road.
Oh, it gets in the nose. The mango habanero gets in the nose.
Yeah, so it's deceiving because it's like
Do you want some milk, Dave?
I need milk. No, I'm good.
I'm gonna drink the ranch. Give it a second. Ooh, that's hot.
I wish I could sing.
So drink that
This?
or just
No, I'm just. I'm
Like,
just.
what do you do
just
with that? You
dabbing.
just like
I'm just softening my palate.
in the plan in there.
Yeah. Cleanse the palate a little bit.
it gets in the throat too.
Wow.
I'm gonna go a little more.
It was good. Like I
mango
liked
habanero
it.
is really good.
I liked the sweet and the like super spicy.
Whenever
Not
we
gonna lie.
whenever we travel to see a client or whatever, inevitably Ellen knocks off a little earlier than Justin and I, and we always go for wings, and he always has to get mango habanero. He's got it mapped out in every city where to
Pretty
go.
much.
Eric's like, yes, I can.
Yeah, it's like why do I keep
Yeah, I
going back
totally-
to that?
Ha. All right. So I think my mouth is still working. I definitely
talk about the passionate
yeah.
topic.
Does it do that? Like, does it
I don't
get
know.
so hot that it can
It
numb
does
it?
it, yep.
Yeah. All right. So now the topic, the platform topic of our podcast is we want to hear from each of you. What do you think could affect real change in healthcare? All caps. I want to caveat your answers by saying that when we talked about this ahead of time, what I really liked was you both had the perspective of like, there are a lot of different things that need to change in order to affect real change. That it's not just like one item. You can't pick one thing and fix it. And I liked that. So
Are you
Eric,
okay?
you want to start?
You all right?
It is hot. It is hot.
He's actually breathing.
So maybe
kinda-
you're not ready.
It's okay. It's okay. I think that's the purpose of the Hot Ones episode where you're
You have
sweating a
to
little bit.
you have to keep like trying to talk as if you haven't just eaten an insanely
And the
hot
nose is sweating a
sauce.
little bit. Yeah.
Can
So
you have-
Your face is turning awfully red.
I do.
Eric.
I know it's hot. So
and you haven't
I
had the skull yet.
I love what you just said. I love what Becky said about technology moving faster. And Becky said, I'm not supposed to talk about this, but I'm going to anyway, with having watched in a hotel room watching this Johnny Carson episode rerun. Because I couldn't really switch a channel because I'm in a bad hotel room, I guess, with bad technology. A hotel room. It was a nice hotel, actually. Just they didn't upgrade their TVs in a long time. So I'm flipping through the channels and I do see this old Johnny Carson episode. And I said, I hadn't seen Johnny Carson. Becky says this is dating you a little bit, but I figure we're all over a century old, so it's okay.
Here's Johnny.
And they did a skit. It was unbelievable. He was doing a skit where he was the chief medical officer. And he was having people come in randomly and talk about some of the problems, whether it's getting care, whether it's pain, even a technology kind of play in there a little bit. And this was 1981. And so when you think about, here we are in 2024, and we actually see some of those same challenges today. Pricing transparency and access to physicians. And so obviously Johnny Carson spin, but it's kind of weird that what other industry in this world can you go back 45 years and say, wow, we're still talking about the same things. And not that there hasn't been tremendous progress in healthcare. There obviously has. But from a consumer perspective, it's like price transparency and all this, being in the medical record world for years that Becky and I have been in. I know you guys have seen. But just having friends in my neighborhood text me, it's like, can you guys believe, like on these text chains, can you guys believe that you go to the doctor and you still have to fill out the same paper forms over and over with that same facilities? I'm in Charlotte. And it's just weird. It's just weird to see all this technology and still all the challenges.
It is really
and
interesting.
what we spend.
Yeah.
And what we spend on that.
But I love that point of like, from the outside in and the inside out, right? Like we live and breathe it and try and operationalize it. But then when you're on the outside and you have to like try and navigate or the other way, you know what I'm saying? Yep. It's like, whoa, this is so messed up, And yeah.
I went out, I took the opportunity knowing we were going to do this. And I just talked to fellow CIO, or not fellow, but other CIOs and healthcare leaders and innovation and even physicians. And I asked them this question, what would you change? And most physicians said, take out the friction of the patient-doctor relationship. There's just been so much put in between that he doesn't feel like he can have a relationship with his patients anymore. And he's a leading cardiologist. And so and I think that's why we're seeing more concierge medicine, more like direct access to, because I think physicians and nurses too want to be closer to the patient. And in this guise of doing all this technology, we've removed a lot of that.
Yeah. Well, and that goes back to the disconnect of reimbursement. So economically, we're built on a model of transactions. And so again, that gets down to kind of commoditized efficiency, which then means the less time you spend with the patient, the more margin that you make. And that's the point of the so it's that economic misalignment.
Yep, absolutely.
Yeah. So Becky. We won't make you do a wing before we do
it. Exactly. So I don't break out in a cold sweat, but you're looking better, Eric.
I don't know. It was creeping for me. As you were talking, I'm like, man, I'm really glad I'm not talking right now because I feel like it's
Before he started to answer that question, I could hear him going,
breathing,
getting ready. And I felt the same way. And it's just now when you finish is when my mouth finally feels kind of normal.
And then Justin just held the scale up at me because he knows I'm right.
That's nice.
I was going to do, but I'll do the skull next. It's fine.
Let's hear from Becky. And
with regards to healthcare stuff, but
these are very unhealthy.
I was kind of surprised on that, except for the plant-based. But I do think there's a lot of redundancy that happens in healthcare. So, for the past 20, 30 years, we've been running really fast to put in technology and doing a great job in many ways. But there's a lot of opportunities still out there to smooth the edges, to make the experience better for the patient, the nurse, the physical therapist, the provider, for everyone involved. And of course, even on the regulatory side of things. So that's why we're really hopeful that there will be now a big shift in focus on smoothing the edges, decreasing the regulatory burden so that we can put more time back in the caregivers with it. And that's where they want to spend their time. No one went to nursing school and said, I want to spend all my time doing documentation. But yet today, across the United States, nurses spend between 30 to 40% of their time doing regulatory documentation. Yep. And there's just a reality that we've got to figure out how to way to do that. So I am really excited about the technology that many of us have seen on the horizon. So in the last 5-10 years, you've seen a proliferation of the talkable things that happen. Your devices in your home are listening to you and now taking action on, hey Siri, hey Google, hey Alexa, hey whatever, make a list, take an action. And so we're going to continue to see that. It's already started in the healthcare journey to be able to document for a provider. We're seeing that now move into the nursing space. And the reality is nurses spend a lot of time documenting. We really need to focus on that. And then that too will come to other aspects of the healthcare system. So I'm really excited about that technology. A lot of times people are a little bit leery about the AI, the ambient listening technology. It's not perfect. It's not going to be perfect, but what we really need, again, we can't wait 17 years. We can't raise another generation of humans, and adults to wait until that stuff gets perfected. What we really need is we need people to lean in, jump in, try things out, know it won't be perfect, and then quickly iterate and make it better for everyone.
Yeah.
Great answer.
So are we winging it?
So that we can all focus on just eating hot wings
hot
and
wings.
trying to figure out how do we get how much range is left.
Yeah, no. So it's going to be like if you nail it, then your prize is another hot wing. So you nailed it. So now the prize is another hot wing.
Yay, thank you. I'll have
What's
another.
the prize for the winner anyway?
Well, Justin's the winner.
Hold on, Eric.
I'm doing
competing.
like
Justin.
I can't. We cannot compete with Justin.
I really feel like
I'm
this was
interfering.
Justin's game because
I guess we're
Justin
gonna have
came
to.
here
Yeah.
with all the
Yeah.
sauces, stacking the deck.
You just you got a wing.
Well, I'll do one of
Do
these.
you want
as well.
a wing? Like, do you want me to go get
No,
you a wing? Or are you
that's
okay
okay.
with
It's
that?
all right. We're gonna. I said, Eric, if you
I
do
need
it, I'll
the
do
skull
it.
with
It's
your-
not a ton
I'm
of
doing the
it.
skull too.
Now they're mixing the sauces.
Okay,
for
we're all
anybody
doing the
who knows.
skull.
Oh, you gotta like.
How come there's a medical warning label on the bottom of this? It says,
Whoa.
do not
Okay,
mix
dude.
more than 3
All right.
sauces together. No, I'm just kidding.
Is that too much?
Surgeon General's
All
warning.
right. Let me have the skull.
I gotta get
Oh,
mine.
you haven't gotten any yet.
That's
Oh,
enough.
that's
That's
not
enough.
nearly enough.
Oh no, dear Lord.
It's amazing, though.
I was,
Okay,
I was
all
gonna.
right.
I'm a risk
Oh,
taker,
no.
and yet I'm.
Get the beer ready.
I
Ellen
was
wants to do
I
it.
think Justin's probably a little surprised at
Becca,
my.
are you doing the skull?
I figured you'd be in
I'm
the.
not going
Don't do the skull.
That was
Is
gonna
that
be where I
all
was gonna
skull
be, but
right
then
there?
I was like,
Skull mixed with
Look at this guy.
mango
I mean,
habanero.
I've done
All right,
some
are we
pretty
ready?
crazy
I'll throw some
hard.
mango.
Wait, I'm in on this
Yeah,
too.
let's see
All
what.
right, let's wait for Ellen.
I'm gonna throw a little mango
but
habanero on that.
Which one?
All right, is this appropriate?
Yeah, you got to douse it.
Okay,
Oh,
have you?
that's
I
good.
want to be like.
I'm very proud of you.
So am I.
Am
I'm
I
impressed.
doused it appropriately?
You're doused
I'm
appropriately.
proud of all of us.
All right.
You have
Okay.
a clinician in the room, so
Yeah.
if anybody needs.
Okay,
All right,
good.
here we go with
go.
the skull. We're
1,
going
2,
with the skull.
3. All right, so far so good.
I'm always going to creep. I
Half
can
a
tell
second
you.
later.
Oh yeah.
I can see Eric taking deep breaths.
I would hit you. It's tolerable though.
So far, just wait.
I didn't put anything in here that I thought would. I did not
Kill
go
us?
up the ghost pepper scale or any of that stuff. I stated habanero.
Let me ask you this: how many? I know you don't remember
did
the
it.
exact numbers on the scale, but how many? How many? How many are between this one and the skull on the scale?
It's pretty close.
Okay, so it's not much higher than that.
Yep,
There's probably lots beyond the skull.
absolutely.
For sure.
Right.
I mean, for sure.
Right. Okay.
I just tried to make sure we weren't.
No, that was
he didn't
good.
want
You did
anybody
good.
falling on
Yeah.
the floor.
I'm
That's-
excited though. Like there's something here, man. Like I can actually participate in
Yes.
this. See, this was like worrying me because I'm like, I can't be like host of a show that I have to just sit on the sidelines and be like, I can't do
Well,
it.
when we talked to prep for this, a week or so ago, and we learned that it was A, Eric's idea, and B, he didn't think he was going to be able to do the hot ones. I think,
He
showed up.
you showed up.
He showed
man.
up.
You threw
Yeah.
down.
It's good.
And it's starting to creep up.
It is. My tongue is
But
definitely.
let's go. Okay, but let's go ahead and move on to the next question. And
Well, no,
we're-
I actually want to comment on
Oh, okay.
Becky's
Yeah,
point
go ahead.
about AI. So I've thought a lot.
gonna make you go first.
I've really been we've really been trying. We've kind of jumped in full on embracing more of these like newer meet people where they are, new models of care. We talked about that earlier today, and aligning those with outcomes based care and things like that. But that brings me to the whole point. We just talked to John Corus about this. Like the system, the way it's built today, is flawed. I mean, we all know this, right?
Mm-hmm.
And so when we think about a redesigned healthcare system, I mean, why do you make a physician? And I know people will die when they hear this, but like, why are we making med school? like organic chemistry, and like with all of the technology and information available at our fingertips now, right? Why are we, and we know how intellect and emotional intelligence, like a lot of people would say there are a lot of people that would be really good caregivers and they're really smart people, but they can't go do organic chemistry, right? They don't want to go through med school and then residency. They don't want to spend 10 years, whatever. And plus med school isn't even a healthy environment. Residency isn't even a healthy thing to do. So isn't there, like, I look at it and say, there's got to be a future where we can attract different people into the medical profession and leverage all of the information that's out there so that we can have a different type of caregiver. I'm not saying to replace the physician necessarily, right? But like a real redesigned model where you maybe have somebody that's a little more suited and leveraging all of the information using AI from that perspective, So anyways, I just had to throw that into your point.
And wasn't some of that the reason why you didn't pursue medical school? You didn't want to do
I'm just making an excuse for myself, really. So,
That's where I was going.
I couldn't even make it to organic chemistry. I got a D in college chem, and that was after passing the AP exam in high school. Like
I was going to be a marine biologist.
Yeah.
Like George Costanza.
Failed out of biology.
Right.
Yeah,
It happens every day.
And I love dolphins. I was going to live in Florida.
Yeah, your brain is either wired one way or the other. And so I don't know. It's a question. I'm not suggesting that like I have this foregone conclusion, but I'm just really trying to open my mind to say like, how can we change things systematically, take advantage of what's out there? So,
all right. So the question is, what would be your buy the world a Coke or when pigs fly idea for fixing the healthcare system? And we'll start with you, Becky, since Eric over here is still struggling from the...
He's going to ask for a paper bag here in a second and breathe into it. So
he's good.
Just to follow up on the point you made. So what I tell folks, when you're thinking about technology and AI and all of the new development that is occurring that we're living in right now, it is not to replace the caregivers. It is, we're in a shortage. We're going to be in a shortage. Yep. So it is to fill the empty seat. Right. Exactly. The seat is empty. So this is to help the, nurse that's coming to take care of, 5 patients and someone calls in sick. And so now that nurse is being asked to take care of 7 patients, 8 patients, we have to figure out the technology to help fill the empty seat that exists. And it's not just nurses, it's physical therapists, pharmacists, providers, everybody is going to need some additional support. So it's really to help fill those seats. And so, there are great medical schools that are embracing innovation, entrepreneurship, and really bringing that technology to make the caregivers really learn how to take care of patients better. So that's what I'm really excited about, is that I think it will be, but the care models will have to shift. And you're right, we're going to have different folks that are going to collect information, different technology that might collect information. Yep. We were talking about some of the other companies that have come up on the scenes in the last few years, just about you can walk into a pod and get all of your lab work done, your x-rays done, your you can go see a physical therapist today without a provider's order up to a certain amount. And so there's things that folks can take upon themselves. So that will be the shifting that I think we'll continue to see. But if I could buy the world a Coke, now everybody's going to have that song stuck in their head.
I would buy the world kale.
Trust me, we sing it almost every episode.
Can we do it? No.
Okay, so I'd like to buy the world a Coke. See, this, we always get it wrong.
And keep it company.
See, what it is I'd like to teach the world to sing.
In perfect harmony.
And then I'd like to buy the world a Coke.
And keep it company.
So let's start from the top.
Sponsored by Coca-Cola.
I'd like to teach the world to sing in perfect harmony. I'd like to buy the world a Coke. And keep it company. That's the real thing.
Okay, that's the best one we've done yet.
It is totally.
And I helped because I didn't sing and I have a horrible voice. So I just kind of mouthed it a little bit.
He was still.
I am going to tell you, my
we nailed that. Well, now we're definitely getting a cease and desist from Coca-Cola.
Like my tongue, maybe that's why I sang a little bit. My tongue has been like loosened up.
I don't know. They might not want to be. Coca-Cola
associated with this.
Coca-Cola's either going to.
All right, she really is ready to tell us the answer. We sang.
What I would love to see continue to shift is really a focus on the work-life experience of women. More than 80% of all healthcare is delivered by women. not just nursing, but providers, all different aspects. And there's just a real reality that there's still some challenges that women face from a work-life experience. We saw a big shift of nurses out of the career path of being in nursing during the pandemic because they have responsibilities at home for education, taking care of children, making healthcare decisions for themselves, for their children, and for their extended family. And so the reality is, if we do not understand the challenges that women face in getting healthcare for themselves, for their children, for their family, if we don't understand how women have to manage all that at home and also try to come to work, then we really kind of miss out. So for example, there's been a big focus in the past years and will continue about is it good to have a 12-hour shift? Is the 12-hour shift the ideal shift? Well, not if you got to get, children, home from school and onto a soccer field or to, other activities that happen in a family or to healthcare, et cetera. It's really hard to be able to do that. As a mom, I've lived that experience. I have lots of friends and family that have done that too. So we have to figure out how to make that easier. So is that PRN shifts, meaning that you work from 9 to 1, then you work from 1 to 4. Telehealth has really opened up a lot of opportunity where nurses might have to say like, hey, I'm going to have to quit being a nurse because I can't work 40 hours this week. But
or
you might
night rotating like that.
Right.
Like that.
Yeah.
My wife at the Brigham, she had to do day night rotating shifts. So you lose touch with the reality when you're half the time you're spent up at night, and the next week it's rotating over. You can't get used to that type of stuff,
Right. So we really have to understand what that work experience is for women, what the home life experience is for women, and together determine with women at the table, with women in the conversations, determine how do we help meet the needs of patients and yet drive our healthcare needs and bring technology into that. And then the other thing is to realize that's where the money-making decisions are made. Women make the decisions of where healthcare is spent. So convenience is going to be the winner. Whoever makes it convenient. So if I can go to the grocery store and take my 3 children and get a primary care visit at the same time and get the oil
and
changed.
walk down the aisle to buy the food that you need for your inflammatory issues or your diabetes, like redesigning the grocery store. I mean, the other piece I'll add to your statement about women is, medical research doesn't include women largely.
Correct.
The foundation upon which we practice medicine is largely missing women from the research and clinical studies and everything as a basis. So it is a real, I don't typically go down that lane very often of, that whole component of our society, but it's absolutely critical. I agree with you.
And it's not to bash. So it's not to say, let's look at how terrible it's been.
What's going on?
No.
Side of the table.
Yeah, I know. But what
you guys screwed everything up.
Crickets over here.
No. But what I'm saying, it's not to say that there's all these wrongs that have happened. No. It is to say this is how the future needs to be different.
Meet people where they are.
Right. And to leverage the data. So the reality is 80% of healthcare is delivered by women. Women are the primary decision makers and where money is spent for healthcare. And so how do we make sure that we're attracting the right patients and serving the needs that they have, meeting them where they are, and making sure we're maintaining a healthy workforce? And then the other thing is women's health outcomes also shows that. So the United States has got great medical care, and yet the women's health outcomes are not illustrating that. So we need to have a focus there. So there's lots of opportunities there. So if I could wave the magic wand and make some things happen, it would be a revitalization of how do we look at our customers and serve the patient care needs and make those things easier, because convenience is going to be the key to winning.
Excellent. That's going to be hard to follow.
Good luck, Eric.
I would say I'm not even going to try. But
well,
that's why.
But
that's why.
So
that was like phoning a friend.
Oh, okay. There you go.
And I will tell you, I kind of think of it 2 ways, really. I mean, the short answer for me, again, that consumer lens, is just price transparency. Tell me what I'm going to pay. Tell me what I'm getting it for. We are so risk averse. Everyone is so risk averse, worried about getting sued. I literally tell my wife I don't want to go to the doctor for any reason because they're going to scan me for every possible thing instead of just really targeting what they kind of know the answer is. It's like telling Becky earlier, I take my dog to the vet. They come in and say, these are the 6 things we're going to do. And I can ask the vet, do we really need to do all of these 6? Because I know this guy. He knows me. He knows my dog. And he says, no.
it's like when you go to take the car to the shop. And you don't
you need a new flux capacitor.
And we've talked about this, like,
you're like, I'll pass on that this time.
Yeah, exactly.
Or a Johnson rod.
Or you go back and you're like, oh, I don't really need that.
Another Seinfeld reference.
Yeah.
But that's it. I mean, that's like if I could buy the world some kale, just be transparent with us. And I get it. It's very complex, but at the same time, when I think about the other side of things and how you look at businesses and how fast they're moving in this way of technology in hospitals, you get to this point just to get a contract with a hospital, no matter what you're doing, can take 12 to 18 months, 24 months, go through legal and all the things that need to happen. By the time you get your contract signed, the technology is already outdated. It's like we're so risk averse, we're not adapting the technology fast enough to impact the very patients that could benefit from it.
Risk averse and bureaucratic.
Yes.
That there are systems in place designed to completely prevent
That's right.
the rapid speed that you're talking about from ever happening. So, Eric, can you tell us about Revuud and what you're doing there?
Yeah, so I appreciate it. After the introduction, I mean, it's exactly what David mentioned. Being in this industry for 15 plus years in the healthcare IT space, we saw an opportunity to improve this. We saw an opportunity to bring talent to hospitals in new ways that they weren't able to do. Easier, faster, the right talent at the right time with the use of technology. We're starting in the information technology world. It's just an area that I know and am passionate about. But at the end of the day, we do feel that can scale throughout the hospital system. As Becky alludes to, like, do we have to do 12-hour shifts for nurses? Maybe they're 4-hour shifts. And we've had conversations with healthcare leaders about this, but how do we implement that? And how do we use technology to kind of track all that and be able to work with people in the ways they want to work? They don't necessarily want to work 36, 40 hours of work a week anymore. They want to work 10 hours here, 10 hours there, support these hospitals in different ways. And we're truly impacting hospitals, the ones that embrace new work models and getting more done. We've all sat in rooms where the whiteboard it's too big. 180 programs. They want to implement all of them. They all have ROI. They have clinical benefit to doing so, which affects the patient, but they can't do it. They don't have the people. They don't have the time. So by embracing and just bringing in these people via what we hope to bring change to hospitals by bringing those people in fractionally, kind of like a scalpel is what one of our advisors used to call it, to kind of healthcare IT consulting.
One of the things that, Eric and I have chatted about, and one of the things that I've seen from being in a leadership role within informatics is, there's still a 7 to 5 type of schedule that happens with your staff. And so how do you, and the reality is things need to get built, tested, designed, rolled out, implemented much faster. And the only way to do that is either to scale on people or to scale on time. Most of the time, people don't want to stretch out a project to 18 to 24 months because, again, the technology is too old. So the only way that you can do that is you've got to go faster. So you've got to be able to supplement your staff on different time zones, folks that want to work different shifts, different timeframes to meet their work-life balance, then that's an opportunity that you can give them by, so it's a good opportunity for staff to have a different way of working rather than I don't want to say it's a 9 to 5, but a 7 to 5 type of schedule. How can we work after hours, weekends, and really expand that informatics aspects to make it really 24/7? And the way to do that is by looking at companies like that.
So let's do it again. Goose and Maverick. You guys, because that just, you like set up you ready? You guys in synchronicity here. Ready?
I feel the need for speed.
There we go.
What's your website?
www.revuud.com.
With 2 U's.
RVUUD.com.
Hey guys, thanks so much for coming. It's been a great conversation.
Yeah, cheers.
Thanks for doing the inaugural.
I'm so glad we all survived.
Everyone survived.
Cheers. Created a new theme. Thanks again for the discussion today. Am I supposed to close it down? Oh yeah, thanks again. I'm Ellen Brown.
I'm Dave Pavlik.
I'm Justin Politti.
We are the partners at BP2 Health, your best chance for real change. As you can tell, we can talk about this stuff all day and possibly eat wings all day.
Drop us a line. Let us know too if you want to be on a next episode of the Hot Sauce
Version 2. You might amp it up a little bit.
At BP2Health.com.